Welcome to the Psychology and Physical Training channel, Psychopathology Biological Therapies. Have you ever pondered the crucial role therapy plays in treating psychopathology? It's a fascinating question, isn't it? The importance of therapy in its many forms serves as a crucial tool in managing a host of mental health conditions, collectively known as psychopathologies. These conditions, which range from anxiety disorders to mood disorders and beyond, can deeply impact an individual's life. But fear not, for therapy is here to help. It's a powerful instrument that can significantly improve one's quality of life, often working hand in hand with other treatments to provide a holistic approach. And the best part? There's not just one type of therapy. There's a whole spectrum of therapies, each designed to address specific challenges. In the upcoming segments of this video, we will explore a range of therapies, from biological to non-biological, each with its unique approach and methods. As we delve deeper, we will explore the evolution of therapies, starting from the earliest form, biological therapies. Chemotherapy, the earliest form of therapy, marked a significant milestone in the treatment of psychopathology. Chemotherapy isn't just about treating cancer. Its roots are firmly planted in the field of psychopathology, where it served as the cornerstone of biological therapy. This form of therapy introduced the concept of treating mental disorders with chemical agents, providing a new perspective on the management of psychological conditions. The advent of chemotherapy in psychopathology started in the early 20th century. In those days, the belief was that mental illnesses were purely psychological or spiritual in nature. However, the success of chemotherapy in treating syphilis, a bacterial infection that could lead to mental disorders, challenged this belief. It opened doors to the idea that mental illnesses could also have a biological basis and could be treated biologically. Chemotherapy's role in psychopathology expanded with the development of new drugs. Antipsychotics, antidepressants, and mood stabilizers were introduced, providing relief for conditions that were previously considered untreatable. These drugs, acting on the brain's chemistry, helped to manage symptoms and improve quality of life for countless individuals. Yet, chemotherapy is not without its limitations. It can cause a range of side effects, from mild ones like nausea to severe ones such as cognitive impairment or heart problems. Moreover, it doesn't cure the underlying cause of the disorder, but merely manages the symptoms. Additionally, it's not effective for everyone. Some individuals may not respond to medication at all, or worse, their condition may exacerbate. Despite these challenges, chemotherapy's importance in psychopathology cannot be understated. It revolutionized our understanding of mental disorders and paved the way for other biological therapies. It demonstrated that mental illnesses have a biological component that can be targeted for treatment. Furthermore, it sparked research into the brain's chemistry and how it relates to mental disorders, leading to the development of more targeted and effective treatments. It's a testament to the power of scientific discovery and its ability to transform lives. Despite its limitations, chemotherapy laid the groundwork for future therapies. Electro Convulsive therapy. The advent of electroconvulsive therapy, or ECT, brought about a new era in the treatment of psychopathology. ECT has been around since the early 20th century, a testament to its staying power in the field of psychology. Its development was fueled by the desire to find an effective treatment for severe psychiatric disorders, particularly depression and schizophrenia. Here's how it works. ECT involves sending a small, controlled amount of electrical current through the brain. This current triggers a brief seizure, which is believed to cause changes in brain chemistry that can quickly reverse symptoms of certain mental health conditions. It's typically used when other treatments have been unsuccessful or need to be avoided due to side effects. Now, let's talk about the benefits. ECT has been found to have a high success rate, particularly for severe depression, and can provide relief more quickly than other therapies. For those grappling with debilitating mental illness, ECT can offer a ray of hope. But it's not without controversy. Critics argue that ECT can cause memory loss and confusion, and question its efficacy, given its invasive nature. However, many of these side effects are temporary, and the procedure has been refined over the years to minimize risks. Despite the debate, it's important to remember that ECT has been a lifeline for many who felt they had run out of options. As with all treatments, it's about finding the right fit for each individual. ECT, while controversial, has proven to be a valuable tool in the arsenal against psychopathology. Psychosurgery, a more radical approach, took the treatment of psychopathology to a new level. Imagine the brain as an intricate, complex web of connections. Now imagine being able to alter those connections, to reshape that web in an attempt to treat mental disorders. This is the essence of psychosurgery. Developed in the mid-20th century, psychosurgery represented a dramatic shift in the treatment of psychopathology. Rather than treating the symptoms, psychosurgery sought to treat the cause by physically altering the brain's structure. Procedures like the lobotomy, once hailed as a breakthrough, were used to treat a variety of mental conditions, from schizophrenia to severe depression. However, as with any radical approach, psychosurgery raised a host of ethical issues. The invasiveness of the procedures, their irreversible nature, and the potential for misuse became sources of intense debate. The question of informed consent, particularly in the case of vulnerable patients, further complicated the ethical landscape. Despite these issues, psychosurgery played a crucial role in advancing our understanding of the brain. It underscored the biological basis of mental disorders and paved the way for less invasive treatments. It also sparked discussions about the ethical boundaries of medical intervention, discussions that continue to shape the field of psychopathology today. Psychosurgery, despite its ethical issues, has provided invaluable insights into the workings of the human brain. Brainwave therapy. Stepping away from the biological, we venture into the realm of brainwave therapy. This intriguing approach to treatment has its roots in the early 20th century, when scientists began investigating the electrical activity of the human brain. Through decades of research, we've come to understand that our brainwaves can influence our feelings, thoughts, and behaviors. Brainwave therapy, in essence, seeks to alter these brainwaves. It's a bit like tuning a radio. Just as we adjust the dial to find the right frequency for clear reception, brainwave therapy adjusts our brainwaves to promote optimal mental health. So how does it work? Well, in a typical session, a therapist uses audio or visual stimuli to guide your brain into different states of consciousness. This could be anything from a specific sound frequency to a flickering light. Your brain naturally tries to match this frequency, a phenomenon known as frequency following response. And here's the exciting part. Studies indicate that brainwave therapy can be effective in treating a range of psychopathologies. For instance, it's shown potential in alleviating symptoms of anxiety, depression, and even ADHD. It's a non-invasive, drug-free therapy that encourages the brain to do what it does best: adapt and heal. As we continue to unlock the mysteries of the mind, we're discovering that our brains are far more malleable than we once thought. Brainwave therapy has shown promising results, paving the way for more non-biological therapies. Cognitive therapy. Cognitive therapy, a revolution in non-biological therapies, has changed the way we approach psychopathology. Cognitive therapy, an innovative approach to mental health, was developed in the mid-20th century, marking a significant departure from traditional psychoanalytic methods. Instead of focusing on the unconscious mind, cognitive therapy zeroes in on the conscious thoughts and beliefs that influence our behavior. The brainchild of psychiatrist Aaron T. Beck, cognitive therapy is based on the premise that our thoughts shape our feelings and behaviors, not external events or circumstances. By changing these negative thought patterns, we can alter our perceptions and responses to stressful situations. Cognitive therapy has been effectively used to treat a wide range of disorders, including depression, anxiety, and eating disorders. It helps individuals reframe their negative thinking patterns into more positive, realistic ones, thereby changing their emotional response and behavior. One of the key strengths of cognitive therapy is its focus on the present. While it acknowledges the influence of past experiences, it emphasizes problem-solving in the here and now. This approach makes it a practical, hands-on tool for individuals struggling with mental health issues. The effectiveness of cognitive therapy is backed by a wealth of research, showing significant improvements in mental health outcomes. It's a testament to the power of our thoughts, and how by changing them, we can change our lives. Cognitive therapy has indeed changed the landscape of psychotherapy, offering a fresh perspective on the treatment of psychopathology. And if you like this video, do not forget to subscribe and follow the Psychology and Physical Training channel for more videos. Thank you for watching.